Good afternoon, everyone. Happy Friday. Thank you for joining today. My name is Claire Paprocki, and I am the Public Information Officer for Brown County Public Health. It is my pleasure to share that we have some guests again with us today. We have Brown County Executive Troy Streckenbach, who will have an update on the testing sites. We have Kelly Swatrz from Wisconsin CASA, who is going to talk about the impact of the pandemic on abused and neglected children and what all of us can do to help keep them safe. And with some nicer weather, hopefully nicer than today, nicer weather coming up, we have Matt Kriese from the Brown County Parks Department who is joining us, and he's going to talk about how we can get outside this weekend while still being safe and following proper social distancing and safer at home guidelines. So I will start today's meeting with today's numbers. Brown County is currently at 1,799 confirmed cases. Oneida Nation is reporting out 18 for a total of 1,817. We have 40 individuals who are hospitalized. We have 264 individuals who are out of isolation. Unfortunately, we do have to report our 13th death. This individual was a 69-year-old female from the zip code 54304. Yesterday at the Resch Center, we were able to administer 216 tests. At Casa Alba, they administered 168 tests. So far at both sites, since we began testing, we have been able to test 2,713 individuals. On Monday, we should have some early numbers for you that are related to more specifics of the results that are coming from each of those sites. As a reminder, as we go into the weekend, both testing sites are open until May 16th. Monday through Friday, the hours of operation are 8 a.m. to 6 p.m. On Saturday, the hours of operation are 10 a.m. to 3 p.m. This applies for both sites. They will be closed on Sunday. Both sites will be closed. Please remember to schedule your appointment. We're asking to prioritize those that have symptoms. So it could be one symptom or multiple symptoms. Those are listed on stayhealthybc.com. We're asking this so we can ensure that those who are ill have an opportunity to be tested. You can also call 211 to make an appointment as well. Drive-ups and walk-ups are available at both sites, at the Resch Center and at Casa Alba. Please schedule your appointment for a walk-up though as well. I will now turn it over to Brown County Executive Troy Streckenbach.
For the update and the information. As each day we talk about the numbers, we've obviously see the increased testing is bringing about certain numbers in terms of the total positive. I think one of the things that is encouraging is the numbers of positive versus the test. We're hopefully going to dive deeper into those numbers next week to have a better understanding of what's happening in terms of our community overall. Of course, we're saddened to hear that we had our 13th death. Our thoughts and prayers for all of those involved. We know that in the front lines of the healthcare system, right now it's National Nurses Week, and I just wanted to do a quick shout out to all the nurses in Brown County, particularly Brown County Public Health nurses, the nurses at Purveya, at Bellin, at Aurora, HSHS. Thank you for all of your services and being at the front lines to be that first face that we see when we need help. And so just wanted to recognize that it is National Nurses Week. Also wanted to make sure that when we talk about the test sites, we had an opportunity today to go visit and see Casa Alba location in progress We got to meet with the health professionals from the different hospitals who are helping us, Bellin, Aurora, and Prevea, and kind of get some idea of what are they hearing from the individual people who are coming through the test. One of the things that I heard was that individuals who are coming to get the test were very thankful that this service is being provided. So again, thank you to the National Guard and Governor Evers for bringing the testing capabilities to our region and to our county. And what I heard from the National Guard, who are the individuals who are actually performing the test, generally speaking, most people are basically felt that the experience was fine. It's like what was said earlier, roughly about 3 minutes in total for the process to take place from start to finish. And ultimately, the individuals who are coming through felt that they were very thankful for this test to be being provided. So, we want to really encourage the residents of both Brown County and individuals who work in Brown County. If you have the slightest symptoms that meet the public health's criteria, we really encourage you to come out. Right now, we have these testing sites up, both at the Resch Center and Casa Alba until May 16th with the assistance of National Guard. And here's an opportunity for you to learn whether or not you have the COVID virus, and it also gives really public health the opportunity to kind of do that contact tracing. It allows us to better get a handle on how prevalent it is in our community. And ultimately, this is one of our pathways forward in terms of being able to come back to some normalcy, of which we all know is something that we are all longing for. As you're aware, one of the things that happens in our community and things that are already kind of part of our operations, or is part of our operations, it seems to kind of. But with this pandemic and the isolation that's taken place, there is an increased concern over domestic violence and child abuse and neglect. There are a lot of reasons for this, and it's something that every citizen can play a role in helping us combat. And if you see something, make sure you say something. We are fortunate to have Kelly Swatrz, who is with Director of the Program Administration for Wisconsin CASA, stands for Court Appointed Special Advocates. Kelly's going to talk to us a little bit about what Wisconsin CASA represents and some things that we can do to protect children in our communities. Kelly?
Good afternoon. Thank you so much for having us. We are a statewide network of programs that work with advocates in our communities, and these advocates are the eyes and ears of children in the child welfare system. Right now, these children are probably more vulnerable than ever. Abuse and neglect is certainly something that continues to happen. We're lucky in that our current advocates are continuing to stay in touch with the children that they are serving. Many of those contacts are virtual, and sometimes they're even more frequent because there is such a risk for these families right now. And, this is a pretty concerning time for children that we are currently serving, and pretty much any child. We're seeing families stressed now more than ever because they are home, sometimes 24/7, or definitely more than typical, and it could be a potentially unsafe situation. And mandatory reporters that we historically have been relying on, to name a couple, are teachers, school counselors, potentially even doctors or nurses. They're not seeing them as frequently as previous. So it's important that as community members, we stay in touch. We see something, we say something. There's a National Child Abuse Hotline. Certainly call that. Call your local county departments. if you suspect abuse or if you see anything, it's better to say something. And, our goal is to make sure that children in our communities stay safe. And now more than ever, we're in need of CASA advocates. And fortunately, all of this is being done virtual. So if you're interested in becoming a CASA advocate, if you're interested in helping children in your community, certainly visit our website, wisconsincasa.org. We really appreciate the opportunity to talk with each and every one of you. And if you have any questions, we're always here to help. Thank you so much.
Thank you, Kelly, for kind of talking about one of the important aspects to every community throughout this United States, and particularly here in Wisconsin and Brown County. And, as Kelly mentioned, we do heavily rely on that normal set of circumstances as, with schools, doctor visits. These are our normal ways of us to find and indicate where there might be child abuse or neglect taking place. That'll then, gets funneled or reported up to both the county and then to the state. Without that in place, of course, now we have to rely on the community. And I think that was really one of the big pushes today, is that, as we look across how this pandemic is impacting us, we obviously know that the things that are right in front of us, we're not able to work in our normal settings. We're not able to go visit our family, our friends, our loved ones. But there's also this other side that, a lot of times people don't always want to know what Brown County does in terms of protecting the vulnerable and, the people who can't protect themselves. And this is a piece of what Brown County represents. And so a strong shout out for the Child Protective Services. We do have a strong relationship with the local CASA here in Brown County. And I guess the main message is this: if you see something, say something. Let's protect the children of our community. It is, tomorrow going to be, it is another one of those awareness days, but it's Children's Mental Health Awareness Day. And what we heard from Dr. Emily Redemaker yesterday from Bellin was about the importance of outdoor exercise for both physical and mental reasons. And, one of the things that's important for us is to be able to have recreational opportunities. And I think, from a family's perspective, if you have children at home, getting them outside, getting them away from the screens, getting them into nature, or just having an opportunity to have some exercise, I think would be a great opportunity for them to, just be able to enjoy the outdoors, some family time, and also just, exercise. And to hear a little bit more about the recreational opportunities in Brown County, I have our Parks Director, Matt Kriese, to talk a little bit about the different aspects that Brown County has available to the residents of Brown County. Matt?
Thank you, Troy. I want to thank all of those that are so involved, including our county health department and from nonprofits to government response. I think it's fantastic. Not a lot of people realize that through this pandemic, what the parks are meaning to our communities, not only in Northeast Wisconsin, but the state as a whole and on a national level as well, particularly for the mental well-being of being outside and enjoying the recreation areas. Our parks are gathering spaces. They always have been, and they continue to be. And at this point in time, during the pandemic, we are seeing an increase. If we compare last season at the same time to where we're at right now, there's no doubt there's an increase, and that's great to see. We're happy to accommodate people and get them outside and get them out of their house, away from their screens. Some things that we're doing to protect the community and staff to limit the spread is we have closed all of our facilities. That includes nature centers, that includes our campground at this time, pavilion rentals. We've removed paper pass options from our outdoor pay stations. Playgrounds are closed and all other congregation areas are closed. So it's important if you are going to be getting outside and enjoying that you plan ahead. I can't stress that enough. Any park area, whether it's in Brown County or across the state, plan on there not being facilities at that spot. So when you are traveling close to home, make sure that you're prepared for that. As well as that, we have installed interpretive signs throughout the parks and educational signs, notifying people and reminding people of what physical distancing is through 6 feet. That trail is 12 feet wide and we can easily physical distance, but sometimes we need a little simple reminder. And that's where our department has stepped in through that signage and also with a social media presence to make sure that people continue to see that and it's on the forefront. In addition to that, we've had a lot of advocacy groups step up and place chalk artwork on our trails. And that's great to see that we're not in this alone. The community is going through this together. And those simple, friendly reminders in a creative fashion are awesome to see. Another thing that we've done is all of our in-person programming has been canceled, but we've been offering different virtual programming options, whether it's on a social media platform or whether it's purchasing a birdhouse kit that you can build with your family at home and watch a video online and something that you can hang in your backyard but also get you outside if you choose not to go to a park. With the remaining public spaces, we are monitoring those park areas. Our park rangers are out and about. And so far we have been seeing adequate physical distancing. And one thing that we do hear often is people pull into a park and they see the parking lots full. And really, it's everybody's responsibility to protect themselves as well as those around you. So if you pull into a park this weekend or in the weeks to come as the weather warms and you see that the parking lot's full, have a plan B, C, and D in mind and be prepared to visit plan B, whatever park that might be, or head back home if you're not comfortable if that park's too full, too busy. So again, it's ever changing as we continue. Our operations change, and we're doing our best through staff protection and community protection. But the recreation areas are great to have in our community, and we're great to see people continually using them. And as our operations change, stay in tune with our websites, our social media, and other press releases. So I want to thank everybody, and I will send it back to you, Executive Streckenbach.
Thank you, Matt, for providing us some information about, as the weekend's coming about and the opportunities to get outside and do it safely. And if you heard both public health and what we've continued to say is make sure when you're outside, wear a mask in public, make sure you're washing your hands, keeping that social distancing. I'm glad to see our parks departments have put in some interpretive signs to help, people visualize what that looks like. And then of course, the constant reminders about just the ideas of, just safety in general. This weekend is a great time to get outside. And more importantly, historically, this weekend represents a special day for all those mothers. And just wanted to say happy Mother's Day to all the mothers in Brown County, specifically my wife, mother. They are special people. And so make sure that if you do get to go outside, or if you're at home and you can call, just make sure you're saying happy Mother's Day to those special ladies. And if you see a nurse, with it being National Nurse Week, make sure you say thank you to them. At this point, Claire, we're completed with the briefs and we're ready for questions.
Thank you, County Executive Troy. I will now open it up for questions. Again, if you could just introduce yourself and the outlet that you're reporting from. Kelly, Matt, and County Executive Troy and I will take questions.
Rob Sussman, WTAQ. My question is for Claire. Earlier on, I'd say about 2.5 weeks ago, we were talking about how testing processing time was taking about 48 hours. And now with the community testing, apparently it's 5 to 7. What is kind of the reasoning for that increase in time taken to process tests?
Yeah, that's a great question. So the 5 to 7 days that is given is actually the entire process. Just because the results come back within 48 hours doesn't mean that that person is notified, that the contact investigation tracing is done, that all loose ends are tied up. We just really want to make sure that when someone is administered a test, they don't have unrealistic expectations of when they will be followed up with, when the results will come in. We're working with all 3 health systems, Prevea, Bellin, and Aurora, and also trying to alleviate people calling our general intake line at Brown County Public Health. So there's no confusion about when there will be follow-up with it. So it's not really that the process has changed. We just want to make sure that the public knows and there's not an influx of calls to any one health system or to us.
So when we at what point in the process do we get those numbers?
As the media, or?
Yes, correct, as the media.
We have a guest coming on Monday to talk about that, like I said in the beginning of the call.
So we get the numbers at the end when all the contact tracing is done, then they get added to the total.
I know what you're getting at. I will have an update for you of the results and data that we've collected thus far on Monday.
Okay.
Mackenzie Amundsen, WBAY. This question is also for Claire. Looking at some of the new information that's been posted to the DHS website about facility investigations, I know that DHS is conducting the testing in the nursing homes and long-term care facilities. 14 listed for Brown County. What does the partnership look like with County Public Health in those facilities after DHS does the testing there?
So like it's been an ongoing partnership with DHS. They're on site, they're administering tests, they're providing guidance. I would say it's a working relationship for not only those targeted facilities, but all facilities in Brown County where we're in constant communication. I know County Executive Troy has talked to Governor Evers multiple times. We're making requests. It's a very fluid relationship, and we're in contact with them almost on a daily basis to ensure that the facilities have what they need and we're getting the support that we need from the state.
I guess following up to that, Claire, with 14 long-term care facilities listed for Brown County, that is among some of the highest in the state. Is there any sort of pinpoint reason, community spread? I mean, what is Brown County Public Health's kind of take on that number?
Yeah, that was really DHS's. They chose who they would like to investigate. So I would direct you back to Jennifer and Stephanie, I believe, are the 2 media contacts. I'm not sure what went into that reasoning, but I have spoken with them in the past, and they said they'd be happy to answer those types of detailed questions for you. Any other questions for County Executive Troy, Matt, Kelly, or myself?
Matt, it's Nate Phelps from Spectrum News. I'm curious to see if you happen to know how much your park visitorship has gone up percentage-wise, and if the kind of precautions, the plan A, B, and C, and masks and all that kind of stuff is applicable to, other parks and other counties around the state.
Yeah, with our numbers, we do use trail counters across the parks. We'll have those numbers and we'll report those as they come in months to come. So nothing right now other than our staff continue to monitor, and we're monitoring, visitorship and parking areas and things like that. Your other part of that question, what was that, Nathan, again? Or is it?
No, sure, Matt. I was just curious, kind of the guidelines that you're using. Are county parks across the state basically telling people the same things, or are you guys an outlier, or is it kind of a general set of rules everyone's operating on?
It is a bit of generalization. We're somewhat following the state park system with facilities closed. Most municipal parks and county parks across the state are doing something very similar. With facilities closed. Some do have them open, but again, we need to continue to monitor our parks and make sure that we're able to physically clean them. So that's why we took some of the precautions that we did in Brown County. And as far as interpretive signs and things like that, I'm not aware of what other municipal, county, or state parks have done. We did just take initiative right away, beginning of or middle of March, and we put those interpretive signs out and started taking proactive steps to protect the community.
Rob Sussman for WTAQ again. This is kind of a more general question. We've seen kind of a steady increase day to day. I mean, yesterday it was something like 60. Today it's something like 90. That's kind of been the way it's been over the past couple of weeks. What does that tell you at public health and kind of on the county level? Are we kind of in a good spot? Are we approaching a good spot as far as controlling COVID-19 in Brown County is concerned?
So my assessment is this: we have been asking for testing for a long time, and we realized early on from what we were seeing, across the United States and globally, that testing was going to be a critical aspect in order to, one, prevent perhaps the outbreak, and two, get a better handle of how prevalent it is in your community, so that you can make plans to be able to either ride it out, quarantine. I mean, part is, as you know, is once you get the positive test, then there's the contact tracing, there's the isolation, quarantining, and so from our perspective, testing was always kind of like a critical point in order for our community to have the ability to manage this. As I said back, late March, when we held the press conference showing that the community test site that we put up, we spent quite a bit of time contacting, the White House, state, in terms of what can we do to get, testing brought to our community. Now, as we have the testing available for individuals who are that have symptoms, those numbers are going to be critical for, one, contact tracing. One, we can identify whether or not there's any other areas within Brown County that we have larger concerns of potential outbreaks. Two, we're able to find, a better gauge as to what is truly happening with the curve, and what are those results going to indicate in terms of, are we getting a handle over this coronavirus? As you're watching in other parts of the state, or you're hearing on, other parts of the United States, there are a lot of states that are going back to business and reopening. You have here in our own state a strong push to reopen because, there are individual families, businesses, small businesses that are suffering. And a lot of people questioning, hey, how are they able to be open with many people going into the store and they're selling this, but here I'm a small little shop that have only a few people coming in and I can't open. So I think it's important for us to be able to better understand how prevalent this is in our community, so that when we do decide, or when the numbers show, or when the state indicates, or if the legislature indicates we are able to reopen, I'm hoping that Brown County is in a much better position for the fact that we were able to test. And, that gives us a better understanding of how we can move forward into the future. So, I'm happy to see that we are increasing our testing. I think all of us realize that there's a percentage of positive rate that comes with that. Our goal, of course, is that positive rate goes down over time. And so it's an issue of increasing testing, more time, and hopefully over time those numbers go down, and that gives us a better ability to be successful into the future.
And just kind of a this is posed for Claire. Can we get percent positive rate? Would those be numbers you'd be able to get for us?
Out of the total number that we've tested?
Yes, indeed.
I think so. Let me take that back to my team and we'll get back to you on Monday.
Appreciate it. Thank you.
Any other questions for the county executive, Kelly, Matt, or myself? All right. Have a great weekend, you guys. Happy Friday.
Thank you.